It's great that we now have the first test.
It's called Liaison, and it's made in Italy.
In some ways, I would call it a game changer.
Enthusiasm from doctors is rare, but this test can do what others haven't done very well. It can detect specific antibodies for the virus that causes COVID-19.
We'll get a sense of what proportion of our population has actually had it, and that'll be very useful from a planning point of view.
Researchers estimate about half of those infected with this coronavirus aren't showing symptoms of COVID-19. Knowing someone was infected can reveal patterns of how this virus is being spread. But scientists say there's a lot that antibody tests can't show us.
So it really says that you've got antibodies against the virus, you've been exposed. It doesn't tell you whether you still have virus.
When a virus enters the body, it takes time for our immune system to produce the right antibodies to go out and destroy it. If an antibody test is done too early, they might not have shown up yet. We also don't know how many antibodies are needed to offer us immunity. And these types of tests don't detect the virus itself.
So you could have antibodies and still be infectious. So you still have to protect others, you still have to protect yourself, but it's kind of nice to know how many people have antibodies.
And that's what the government's Immunity Task Force plans to find out. It will be testing at least 1 million Canadians over the next 2 years. Not quite the quick test Canadians are waiting for, but Canada's top doctor says it will produce valuable data.
Right now, the foundations are being built now that you have the first test.
Hopefully, with many more to follow. Christine Birak, CBC News, Toronto.